Hello, my name is Danielle. This is week 13 video. I completed 85 questions on Kaplan, and UWorld I did 99 questions on the self-reflection quiz. My top 3 missed questions I have reviewed, and all my missed questions. And my top 3 missed questions were, number 1, the nurse prepares to obtain a wound culture for a client in a long-term care facility. In which order will the nurse perform the steps necessary to culture the wound? My order was perform hand hygiene and apply clean gloves, ask the client to rate the pain level using a numeric pain scale, insert tip of sterile swab into wound and gently rotate. Ensure swab tip is in culture medium in collection container, and clean exudate from wound and wound edges. The correct order was completely different from what I put. The correct order was ask the client to rate their pain level using a numeric pain scale, which makes sense. You would want to ask that first. Because if they are in pain, you want to give them some pain medication. Either way, I think that I would give them pain medication to be proactive, because, culturing a wound especially could be painful. The second step was perform hand hygiene and apply clean gloves, which was my first step. So those two were flip-flopped. The third step was clean exudate from wound and wound edges, which makes sense. You want to clean it off, which I thought that you would want to clean it off after getting a swab. So that just didn't really make sense to me. But it says here that the nurse should clean exudate from wound to wound edges to remove skin flora, which prevents possible epidermal contamination of the specimen. So that makes sense. The fourth step is insert tip of sterile swab into the wound and gently rotate. And then that's going to ensure adequate sample obtained. The last step is ensure swab tip is in culture medium in a collection container. You want to make sure that it's collected and put in a container to transport it so that it doesn't get contaminated when getting transported. So that one was a lot for me to learn just because I got the order wrong of those steps. My second one was the nurse prepares to administer hydrocodone in a client diagnosed with breast cancer. Which nursing intervention is essential part of the care plan for this client? So it's a select all that apply question. I put adverse the client to limit weekly alcohol, and instruct the client to cough every 2 hours, and ask the client about herbal supplement use. And those were my first answer about the alcohol was incorrect. So alcohol should be completely eliminated from the client's diet because it can increase nervous system adverse effects such as confusion, dizziness, and lightheadedness, which I obviously knew that. I don't know why I clicked that to be an answer. Another answer that was correct that I didn't choose was include avocados and bananas in the client's diet. High fiber prevents constipation associated with that medication. I didn't choose that one because I didn't realize avocados and bananas were high in fiber. So I did learn that. Instruct the client to cough every 2 hours. I did choose that answer because since it is it does make the person a little bit, they're breathing depressed. I guess coughing can help with that. And also ask the client about herbal supplement use, which was also correct, and I did choose that one. The nurse should first assess the client's history of herbal supplement use prior to hydrocodone administration, because herbs like chamomile can cause addictive sedation. The analgesic effect of hydrocodone also can be inhibited by ginseng. So I did get that correct. So the ones that I got incorrect was the alcohol one, which I understand now. I should have just not even clicked that one because obviously it's a no to being on alcohol or taking alcohol. And my third question was, while ambulating to the bathroom, a client becomes dizzy and loses consciousness. Which intervention should the nurse initiate first if no one else is available to assist? The answer choices were: move the client back into the bed, use the gait belt to lower the client to the floor, initiate the rapid response team, or check the client for an irregular or absent pulse. I thought of ABC, and I chose check the client for an irregular or absent pulse. That was incorrect. The correct answer was use the gait belt to lower the client to the floor. Since it is talking about assisting the client, I guess the nurse should first lower the client to the floor in a safe manner. In this situation, the goal is to keep the client safe along with the nurse. After you have them on the ground, I guess that's when you would check their pulse, see their do your ABCs and all of that. So those were my 3 questions. I guess I learned to more focus on what the question is asking. And that is all. Thank you.